Hello, welcome to this webinar about early discussion and resolution. I'm Melissa Parkerton, the Director for Early Discussion and Resolution at the Oregon Patient Safety Commission.
I'm Bethany Walmsley, Executive Director for the Oregon Patient Safety Commission. This webinar is intended to give you a brief overview of early discussion and resolution, including the goals of this effort, how this works, how you can learn more when you're ready.
We talk about early discussion and resolution, or ER. We talk about a voluntary process that creates a safe space for patients and their families to have an open, caring, and confidential conversation with healthcare facilities or providers when a patient unexpectedly experiences serious physical injury or death during healthcare. The goal is for patients and their healthcare facility or provider to come to a shared understanding about what happened and what happened next. In 2012, the Patient Safety and Defensive Medicine Work Group was convened with a mission to develop a medical liability legislative proposal guided by principles of improving patient safety, effectively compensating injured patients, and reducing medical liability system costs. This work group created Senate Bill 483, which is the process we now call early discussion and resolution. The bill was signed into law on March 18, 2013, after passing through both the House and the Senate with overwhelming bipartisan support.
The discussion and resolution process is intended to help us reach several goals: patient safety, together, resolution, just culture, and reducing malpractice claims. Early discussion and resolution is fundamentally a patient safety initiative. Discussion and working together to understand what happened, persons can learn from the incident and learn how to prevent this from happening to someone else in the future. With state participation, aggregate data can be used to inform effective strategies for resolving adverse healthcare incidents. In addition, identifying and understanding the root causes of adverse healthcare incidents, healthcare facilities and providers create the culture necessary to improve patient safety and prevent injury to their patients in the future. Assessment can be shared throughout organizations to ensure sustained improvement. Further, to improve health care through discussion and resolution, we can share information that will help us understand the role early discussion can play in resolving unintended harm as much as possible, and ultimately what's working well and what isn't, so we share those best practices. No one ever expects to be harmed by our healthcare system, but to build public confidence and trust is to be accountable when it does happen. We must elevate expectations and standards of practice for communication and resolution of patient harm. We must disseminate successful resolution practices across the state, public confidence in the healthcare delivery system. Do what we can to make the patient whole by resolving the incident as soon as possible can be a less stressful and more effective path to achieving resolution. And resolution may help to avoid litigation, reducing the cost and anxiety associated with lengthy legal proceedings. It's been demonstrated in other states with communication and resolution programs. Early discussion and resolution reflects the basic principles of building a culture and moving away from the outdated bad apple thinking. Encouraging providers to talk about what happened and provide support for providers when something unexpected occurs. We support the open dialogue necessary to learn, improve, and prevent future harm, and an environment that prevents costly defensive medicine practices. Engaging in the early discussion and resolution process here in Oregon gives hope that we could see some of the positive trends that other states have seen while actively addressing incidents and providing fair compensation to patients and families when that's appropriate. It's important to note that states like Michigan, Illinois, and Massachusetts have seen very positive results in overall reduction of medical malpractice claims even though programs are on a much smaller scale.
At a basic level, discussion and resolution is a three-step process to help providers and patients find resolution. However, we know every situation is unique, and it's able to modify the process in some ways to meet the needs of the people involved. Let's review the basics now. An early discussion and resolution begins with the filing of a notice of adverse healthcare incident with the Oregon Patient Safety Commission. The notice required is very brief. After confirming that the appropriate person has filed the notice and where the incident occurred, the file provides information about when the incident happened and a brief description of what happened in no more than 500 words. If a provider or facility files a notice, it is their responsibility to provide a copy of the notice to the patient and initiate the early discussion. If the patient files the notice, it is the responsibility of the Commission to inform the named facility or providers so they view the notice filed by the patient and initiate an early discussion if they choose to participate. EDO is a voluntary process, and each party can decide whether this is the best way to address the incident reported. If parties choose to participate, they can engage in a confidential discussion, or more likely, a series of discussions, to seek resolution together. Each session will be different depending on the circumstances, but the topics will likely include those of greatest importance to patients, as information about what happened, possible impact on health, treatment, and follow-up, information about why it happened, including whether or not an error occurred. And additional information will be shared with the patient in the future, of compensation or an offer to waive medical bills. What actions may be taken to prevent recurrence? The kinds of discussions as well as documents or work products associated with any discussion in this process are considered to be confidential. We recommend that the initial discussion happen within 72 hours of a provider filing a notice or being informed that a notice was filed by a patient. Either party may invite additional people to participate in the discussion. Other participants may include family members, an interpreter, a mediator, a patient advocate or representative from customer service, health providers who may not have been involved in the incident, enrichment or quality staff, attorneys for patients or providers, and insurer representatives. Of these discussions is resolution of the incident. Both need to understand what happened and come to an agreement about what should fairly be done about it. Comment to the patient may be appropriate, but there are cases where it may not be. Mediation may be a meaningful component of achieving resolution, or the parties may find that they're able to come to resolution without the involvement of a mediator. The Commission will be maintaining a list of qualified mediators on its website as a resource for patients and providers. However, patients and providers are not limited to selecting a mediator from this list. Parties have agreed on a mediator, they should cost of that mediator unless otherwise agreed to. There may still be cases where resolution is not possible through this process, and people still have the option of seeking legal action. Sharing is very important to us. Learning and improvement, the Commission will request information about resolution of the adverse healthcare incident within 180 days of when the notice was filed. As Bethany already described, we use this information to better understand things that go wrong and how to effectively, fairly resolve them.
To more about early discussion and resolution, you can contact the Oregon Patient Safety Commission by going to our website, emailing us, or calling us directly. When you're ready to learn more, your source of information is our website, where we compile tools and resources for you. If you have a question that simply isn't answered, please call or email us. We're happy to help.
Thanks for joining us today. We hope that you now have a better understanding of the basics of early discussion and resolution and how to learn more. We join us in making a difference in Oregon, both patients and providers.